Hi, my name is Jessica, and the purpose of this video is to do a full head-to-toe assessment. I'm going to start with the head and inspect the scalp and the skin of the face, also looking at the external ear, inside and out around the mouth, and the nose and eyes. What I first want to do is look at the scalp to make sure that I don't see any redness or lesions, and also on the skin. And then I'm going to also take my pen light to look inside the ear, the nose, and the mouth. Can you open and stick your tongue out? Okay. Everything looks good there. My next step would be to look at the eyes. I want to make sure that there's no drainage, and I also want to check the reaction of the pupils to the light. Look straight ahead. Good. Pupils reacted wonderfully. So the next step would be to palpate the skin, and what I'm looking for is the temperature, and also I'm going to palpate the sinuses to make sure that there's no pain. Okay, and let me know if there's any pain with this. Any pain? No. Okay. The next thing is what I'm going to do is look at the neck, and I want to make sure that the thyroid gland isn't protruding, or known as a goiter, and I'm also going to look to see if there's a jugular vein distension. Okay. Can you look to that side? Good. The other side? Good. Okay. The next step would to auscultate the carotid artery, and I'm going to do that with the bell. I'm also going to palpate the carotid artery with two of my fingers going on one side at a time. My next step would be moving to the respiratory system. What I'm going to look for first is to make sure that the breathing is okay and that she's not struggling to breathe. It's kind of difficult now because she has clothes on, so what I'm going to do is auscultate the lungs with my stethoscope. Okay, when my stethoscope touches you, just take a deep breath. Lean forward. I'm going to start on the back. Good. After that, I'm also going to do the cardiac, which I'm going to look at the heart, and I'm going to make sure that you can't see any the pulsing of the heart and anything, which is hard to see because, again, she's wearing clothes, so I'm just going to listen. The next step is I'm going to have my patient lay on the ground so I can inspect her abdomen. Can I pull up your shirt? Mm-hmm. So what I'm going to look for is to make sure that the skin is the stomach is symmetrical. There's no lesions or redness, no swelling, and the contour is good. Now before I palpate, I want to listen for the bowel sounds. I'm going to start in the right lower quadrant. The next step is I'm going to palpate the liver, starting across the umbilicus and moving up. If I had a pen, I would mark it and use my measuring tape to measure the size, which is normally between 6 and 12 centimeters. The next thing I'm going to do is palpate the stomach to make sure that I don't feel any like hernias or anything. Next thing I want to do is have the patient put her hands behind and do a half sit up to make sure I don't see any protruding. Good. So the next thing is I'm going to have the patient sit back up and sit in her chair. And I'm going to be looking at the upper and lower extremities. I'm looking to make sure there's no swelling or redness of edema on both. And then I'm also going to look at the legs. And temperature is good for both. I would do capillary refill on her toes, but she already told me that she has nail polish, so I won't be doing that. But I'm going to check on her hands. Good. The next thing is I'm going to be looking at the pulses, so I'm going to start with the brachial and move to the radial. The femoral will be hard because she's not laying down, and then the popliteal and the dorsus pedis. So keep your arm out. Okay. The next step is to do range of motion. I'm going to have the patient do abduction and adduction. And so can you take your arms and then movement? Okay. And then circumcision, can you take your arms and move them? There you go. And rotate your hands. Good. And then with your feet, can you point them up to the sky and then point them down? Good. And now, can you raise your shoulders? Good. Okay, can you swing your feet forward? Good. Now try to pull back. Good. And that's the end.